Hello. So, you probably want some idea of what it's like to be a nursing student if you're watching this. And as you can probably tell, I'm not your average nursing student as far as age goes. This is actually my third career I'm pursuing, so I'm a career changer. And it's very exciting, actually. If you're wondering what life is like for a nursing student, the best word I can come up with is busy. You will be exceptionally busy. You will be reading constantly. As you can tell, I stacked up some of the books here. Hopefully you can see them. This is just a fraction of them that you'll be reading. And the career itself obviously is very flexible. Going into nursing, you can do anything from working in the military, you can work in a hospital, you can work in a private practice, for a school, for a prison, whatever it is, even for some corporations. So the career itself is very desirable. You probably know that already, but life as a nursing student is exceptional amount of reading, tons of preparation in the lab. You spend a lot of time learning skills, obviously, which you're going to need. And you also spend a lot of time learning things like communication, which sounds very simple, and a lot of you may or may not have taken communication classes in the past. But communication from a nursing perspective is very different than communication in other fields. My entire background is financial sales and a little bit of management. And the communication that I did on a day-to-day basis is very, very different than what I do as a nursing student. If you're wondering if you have any impact at all as a nursing student, you actually do. When you go to clinical, you are assigned to a patient or patients, depending on where you are in your program. And when you do that, if you look at the amount of time that you spend with that patient versus anyone else on the floor, in the unit, whatever, it's exceptionally higher. So when you go in that day, you take your vitals, you do your blood pressure, your temperature, your heart rate, all those things, and then you kind of assess the patient physically, looking at them. You talk to them about the resources they've used in the past, whether it's community clinics, anything else, their immunizations, all kinds of different things. You find out why they're there, any medical problems they have, comorbidities, other issues that may be contributing to their current problem. And when you do this, you really find out some amazing things. You find out, number one, how strong human beings are. You'll meet people that have 20 different medical conditions, and yet they're up and about, they're functioning, they have jobs, they have families, they're members of boards, they're members of their communities, they're very active, they play sports sometimes. And then you'll meet somebody else that has one condition and they can't do anything because it's so debilitating. So you'll see the extremes, and you'll see everything in between. You'll see and meet people that are so excited to meet you. They can't believe how much attention you're giving them. They realize that you're a student, but at the same time, because you're giving them so much attention, they really sincerely appreciate it. And you'll meet other people that no matter what you do, they do not seem to appreciate, and that's fine. That's perfectly normal, perfectly natural. It's just a matter of what the person is like. One of the best pieces of advice that I've gotten so far in this program, I'm a junior now at Pace University, is from one of my professors that was a nurse, visiting service nurse for, I believe it's around 25 years. She said that whatever you do, just remember that every patient is a human being first. Everything else is secondary. Doesn't matter what they're in for, what their history is, if they're a criminal, all of that's irrelevant. They are there, and they're a human being, and if you treat them like that, you'll do well, you'll learn a lot, and you'll love it. So far, for me, it's been incredible. I had almost zero job satisfaction for 17 years in sales. I love selling, I love communicating with people, but I really sincerely had no job satisfaction doing that. And in this program, I've already felt that I've helped people. I've made people feel appreciated, feel respected. They're extremely vulnerable. When you go into a hospital and someone's in a bed and they have tubes coming out of them and they can't do anything, they're on 20 different medications, they're vulnerable. If you can take a vulnerable person and show them that they are not only a human being, but that they're respected and appreciated, and that you understand their vulnerabilities and you're going to do what you can to help them, they really sincerely appreciate that, and you have made a difference. I wish you a lot of luck, and all the best to you.